So today we have Jessica Fredrickson, and we're just really excited. She spoke it all in, and we got such a great response. So we're so happy that she's going to come and talk with us today. Jessica is the Director of Brain Health at Goodwin Living, which offers senior living and healthcare services to adults age 55 and up in Northern Virginia and Washington, D.C., including innovative age-at-home programs, home health, and therapy services. Jessica's passionate about helping older adults live the most fulfilling lives they can with professional experience in senior living management, writing, and public speaking. Her goal is to continue using her talents and passion to help educate and innovate in the area of brain health and dementia support. So we're so happy she's here. Jessica did ask, because she does want to keep this a little interactive. If you've got questions, if you want to put them in the chat, or you can send them to me directly, I can ask them as she proceeds. And thank you so much for joining us today, Jessica.
Yeah, thank you for having me. So excited to be here with everyone. I had a great time getting to know some of you at the PMD Alliance conference. So really excited to be on here with even more of you today. And I'm just going to go over a overview of our StrongerMemory program. It's a really innovative brain health program. We've rolled this out in a few different areas. We have probably, I don't know the last time I counted, but I would say we probably have at least a couple thousand participants across the country. And so I'm excited to tell you all about it. My name's Jessica. Eden gave me a great introduction. I also work with a team of two other individuals on our brain health team. Perry Weinfeld, a certified therapeutic recreation specialist, and Teresa Mandela, who is an RN and has a lot of experience working in senior living, and she's our StrongerMemory outreach coordinator. So after this call, if you are interested in learning more about how you can get started with StrongerMemory, you can adapt this for your own setting or for your group, you can reach out to us and you'll likely be hearing back from Teresa. And Goodwin Living is a nonprofit organization. We really feel our mission is to support, honor, and uplift the lives of older adults and those who care for them. And so StrongerMemory is one way that we can take this outside of the walls of our own communities and our own neighborhoods by sharing this free resource with others. So as we get older or with certain health challenges, we just as a society tend to get worried about dementia. Now, I just like to quickly go through. Dementia is a collective term used to describe a variety of symptoms. So it's a symptom of several underlying diseases and brain disorders. Alzheimer's disease is the most common type of dementia. And so sometimes people use those things interchangeably, but dementia is really a symptom, can be caused by a variety of different disorders. And it is medical. It's not a mental health disorder diagnosis. It is a physical medical challenge in our brain or in our body. It's not a normal part of growing older. Age is a risk factor. There's a few things that we can't control that increase our risk for having some brain change, but it's not a guarantee. So there's a lot that we can do. We're learning more and more as time goes on about these things we can do to improve our brain health. A lot of those include getting good sleep, stress reduction when possible, eating nutritious, lots of vitamins, healthy lean meats, and a lot of green vegetables, and socialization and brain stimulating activity. So we're going to talk about StrongerMemory, which incorporates that socialization and brain stimulating activity together. This is my friend Wendy Liebrick. She was born and raised in Portland, Oregon, been married for 54 years, and she's got 3 children, 7 grandchildren, and 3 grand dogs. And Wendy was really physically active, college graduate, not a high risk for any health or memory challenges. But in 2011, Wendy started repeating her thoughts, forgetting conversations, and she even got lost driving in her Portland neighborhood that she had grown up in her whole life. So she and her husband were getting frustrated and scared because this was starting to impact her daily activities. So she took a test that showed she was having brain challenges. She was diagnosed with something called mild cognitive impairment, or MCI, which is a diagnosis that can lead to dementia over time. And it signifies that there's enough going on with your brain that your memory, your brain function is challenged to the point where it is impacting your daily life. But it's not a formal diagnosis of dementia. It's kind of a precursor to that. So Wendy asked her son, Rob, hey, is there anything I can do to improve my memory, to work on my brain health? And he worked in the field of senior living and had for about a decade. So in 2012, he was introduced to a program that did really simple math, really simple writing and reading out loud with individuals who had very advanced dementia. And that allowed those exercises every day, allowed them to actually stabilize or improve in their test scores. So he thought, maybe I can bring this upstream to help my mom. And Wendy started reading out loud, handwriting, doing simple math, and noticed improvement within a month. He then started using it at his senior living community where he worked at the time. And that journey then led to creating the StrongerMemory curriculum in 2019. And thanks to the generosity of the Liebrick family and the donors to the Goodwin Living Foundation, we posted the StrongerMemory curriculum online for free in 2020. We've done some studies with George Mason. The first one was in 2021. They released a positive initial report on the impact of StrongerMemory on brain health. In 2021, we also launched a national effort with the Village to Village Network and started a second phase of research with George Mason that will actually be presenting next month on January 13th. And then we launched StrongerMemory in the senior centers throughout the state of Maryland, and we received a Virginia grant to roll this out to 100 nursing homes in the next 3 years. So what we found through all of these experiences is that this is a program that doesn't have any side effects. It's not a medication. It's not stressful. The worst thing that happens is you get kind of bored and you decide to stop, or you don't notice a difference and you decide to stop. But we found that people who don't have any brain challenges can benefit. They feel like they can focus better after doing some of the math exercises. People who have just some mild memory challenges or some of the normal things that happen with aging, like forgetting someone's name, but you know where you know them from, you know they're your neighbor, you just can't think of their name. Some of that can be helped by StrongerMemory. And we have people with significant memory and brain challenges or significant focus challenges doing StrongerMemory. So there's really a wide range of people it can benefit, and we've been able to see how different groups can adapt StrongerMemory to best meet their need. So what is this thing I've been talking about? It is a curriculum-based program that consists of 3 simple activities. So you spend 10 minutes a day on each activity, at least 5 days a week. And that's what our research has shown has the best impact to stabilize or improve cognitive functions. So it is 10 minutes of reading aloud, 10 minutes of writing by hand, and 10 minutes of really simple math. This activates the prefrontal cortex of your brain, the part right behind your forehead, and both hemispheres of the brain. So your brain is really working together as one entity to use those neural pathways and connect and recall that information.
We had a question.
Yeah, absolutely.
Someone asked, does doing crossword puzzles, spelling bees, and wordles and playing mahjong help with memory?
That is a great question. I think there is some research on mahjong. Crossword puzzles and things like Wordle and Scrabble, they're working other parts of the brain. Most of the research on crossword puzzles is that it gets you really good at crossword puzzles and that kind of, trivia, but it doesn't necessarily have lasting benefits outside of that. I will say though, it's definitely better than sitting around and not doing anything. Sometimes our brain needs to rest and that's great, but if you enjoy doing something and it feels, it could be, maybe it's a stress reliever rather than a brain exercise, there's still something good coming from it, but there's not as much research on crossword puzzles. I do think I'm going to write that down though, because I do think there was some recent research on Mahjong being helpful. So I'll look that up and see if I can send that out. Great. Any other questions? Okay, keep going. So this analogy shows kind of what we're trying to do with stronger memory. We're trying to light up our whole brain at once. So we look at brain scans of activities like looking out the window or watching TV or doing really difficult math problems, so solving for a difficult equation. We're only activating a few parts of our brain at one time. So we're working one part of our brain, maybe a lot, maybe not so much, but it's not helping our memory, recall, and focus. When we do these really intentional brain activities of reading aloud, simple math, and writing by hand, we're activating that prefrontal cortex and wide areas on both sides of our brain. So our brains, if you look at them under a brain scan, they're lighting up like a bright light bulb. And so stronger memory is activating our neural pathways and working memory to improve that recall, memory, and focus. I like to compare it to our muscles. We know that if we exercise and we use our muscles, they might grow stronger, they'll stay strong. If we don't use our muscles, then, over time, they're not going to stay as strong. So stronger memory is that way to really exercise that recall throughout our whole brain so that we can keep those neural pathways strong. This is an example of some of the math.
Quick question though, before you continue, does somebody ask, why is reading out loud better than silent reading?
Great question. So reading out loud is better in a few ways. It's better for our memory and recall of what we're reading, but it also works more areas of our brain. It's not just our eyes kind of skimming and processing the information, but then we also are, our brain is communicating that with the other parts of our body to our vocal cords, our mouth, our lips to form those words out. In terms of, so that's kind of what's going on in the brain in terms of trying to activate as much of the brain as possible. Reading aloud in and of itself, though, also helps us with our comprehension and memory of what we're reading, because we are less likely to switch or, autocorrect, make up words as we're skimming. I know sometimes if we haven't been reading aloud a lot, and then we suddenly start reading aloud, we might realize that we skip words or we replace words. When we're reading to ourselves in our head, we don't realize that we're doing that. We don't notice it. But when we're reading aloud, it forces us to slow down, to pay more attention to it. And that generally helps us remember the information better. Now, I have probably a quarter to a third of people who read aloud and have told me that they remember reading words they read aloud less because they're reading aloud almost as if it's a performance. So they're focused on their diction and how they're reading aloud and their tone of voice. And that's a great brain exercise. So either way you're working the brain, it just depends on, most people remember better if they're reading aloud. Great question. So like I said, these are the math problems. They are simple because the goal is just to get that math done quickly, to just recall that answer. We're not checking, can you solve equations? Can you solve difficult math? It's really exercising that part of the brain that just knows, oh, 16 plus 2 is 18, 16 plus 2 is 19, 17 plus 1 is 18, 17 plus 2 is 19. It's really just doing that quickly. And that helps with recall. It also helps our focus. So I did the math, especially after I got COVID. I had some brain fog following COVID last January. And when I had to make a presentation like this one, I would sit down and do 10 minutes of math first, because this really simple math would just kind of wake my brain up and help me focus on what it was that I had to say. It helped me, be able to think of what I wanted to say instead of stumbling or getting lost in that brain fog.
Well, we're talking about math. Somebody asked about Sudoku. Does that help with the brain?
Sudoku, yeah. Another one, I'll have to look up the research for Sudoku. Sudoku is definitely more problem solving. So it's not working the same area of the brain that StrongerMemory works, but it's definitely not bad for your brain. I would guess, without looking at a research article, my educated guess would be, if you're learning how to do Sudoku or challenging your brain to do that, that's helping the problem solving part of your brain. It's helping maybe with some of that brain elasticity so that you can solve problems.
And one other question, somebody pointed out that, this specific math sheet is kind of going in consecutive order. Would it be better to normally mix up the math problems a little bit, or it doesn't really matter? It's just about doing them?
Yeah, it doesn't really matter. It's just about doing them. We have a mix of both in our workbook that's available online, because we found, this works with a whole range of individuals. So some people are at the point where they really need and appreciate the consecutive math. Sometimes it's an exercise in focus, because it will be consecutive for a while and then the pattern changes. So sometimes you get the answer wrong because, oh, I forgot. I didn't realize that changed. I was just going with the pattern. But it really doesn't matter as long as it's easy, simple math. That's really the goal. I've worked with some people who are, did math as part of their career on a daily basis. And so they might do some multiplication even. I think typically what I'll recommend is if we're doing 12 times 12 times tables, if you go up that high, you're probably still doing that really simple, quick solving math. Great question.
And also, would math flashcards help as well, as long as they kept it simple? It doesn't have to be a worksheet.
Yes, I encourage people to either read and say the answer aloud, or to write it down so that you're just engaging part of your body in with the exercise as well. But yes, math flashcards are great too. I have a lot of people who use those. There's a few flashcard apps you can get on your iPad or your smartphone. There's a big variety of those. So whatever way you can access math problems is a great one. Great. So the next exercise is the writing. You can really write about anything. I know a lot of our participants journal. Some will write letters to family, friends, grandchildren, but we also have about 200 writing prompts online, so that you never sit down and wonder, oh, what should I write about? So these are an example of some of them. I always like to hear, what did you do with your first paycheck? And I find it interesting. Some people count that as their first paycheck from their paper route, whereas others count it from their first, paycheck from their first full-time job. So it's really interesting. This is where having a group to connect with about StrongerMemory can be really helpful. So doing these exercises on your own independently is great. The model that a lot of our participants use is they will actually meet once a week, either via Zoom or in person, with other individuals who are doing StrongerMemory to talk about what they read, what they wrote about. And it really helps build that sense of community because you're learning more about each other and you're realizing that, oh, I'm not the only person here who forgets their neighbors' names all the time or missed an appointment. It helps kind of normalize what is normal in terms of memory lapses when we're stressed, when we're aging, when we have a lot going on, and provides that support for those bigger challenges as well. You can write about anything. Like I said, I had one gentleman who wrote in Irish. He copied in Irish because he was learning Irish again. And I have another gentleman. He is a retired Navy officer, and so his passion was Navy policy and procedure. So he would write essays on Navy policy and procedure, and that was what interested him, what he wanted to write about. And so that's what he did. You can really write about anything. It's that act of writing by hand versus typing that we really want. When we're typing, and there's some articles on this, we're making, our hands are doing this up and down motion. They're doing the same motion over and over. When we're writing by hand, I'm left-handed, so when I gesture, it always looks like it's coming from the wrong side, but we're writing with our hand, we're forming each letter, and our brains are working in a different way than if we're just typing it out and doing that same motion.
Question. You did answer one question because somebody asked about writing by hand versus, but then someone also asked, does it matter if you're doing cursive or regular print? Does that matter?
Yeah, I think, if you can write in cursive, go ahead and try to write in cursive. But if you write in print, that's fine too. I generally say, what are you most comfortable writing in? What did you really, when you were writing things out a lot, whether it was when you were in school or, at work, what do you typically use? And go ahead and use that. The other question I get about the writing is, what do I do if I have some writing challenges, if I have some hand, difficulty, arthritis, or tremors that make it difficult to write? And so certainly one way is to partner up with someone and just talk about the exercises, the writing prompts. Having intellectual conversation is still really important and beneficial. The other way is to use an assistive tool. One that I've recently discovered is a weighted pen. So the pen has a weight to it. It's a little bit easier to hold, especially if you put the cap on the back. It's easier to hold if your hand is shaking, or if you have arthritis, then maybe you need a special grip in addition to a pen with a different weight. So there are some things you can try if you have some physical limitations to the writing, because that's one I get a lot too. It doesn't matter if your handwriting is good or bad. It's the act of writing it out that is really important. So even if nobody can read your handwriting, if you still, are benefiting from writing that out, then keep it up.
Along that line, though, somebody did ask about if you had a brand name for the weighted pen, but does copying something help, or should you be creating new writing? Is it the act of creating the new, or is it just the writing itself, I guess?
I think copying is fine in my experience. The only thing I have found is that if you're doing more so with the reading aloud, if you're reciting something from memory, that's not the same as reading aloud. But with the writing, I have some people who do copy, and that still seems to work. The same areas of the brain, they still see those results. I can send out a name for the pen. I know I got it online. I think I got it on Amazon and searched weighted pens, and they have different weights, but I can send over a link when I send the PowerPoint. So you can share that. Great. So our last exercise then is the reading aloud. And I always tell people to read something you enjoy. Often, unless we have young children in our lives, we stop reading aloud after we're in school. And it can be a little weird to read aloud again, especially, if we're just reading to ourselves. So read something that you enjoy, that you want to pick up. You can read, with a partner. I have several participants, probably several dozen participants who call each other on the phone every morning, and they do their 10 minutes each of reading aloud, and they're reading the same book together. So that's one way to do it. You could also read aloud to a friend, spouse, child, or pet. A lot of people will say, it was weird reading aloud to myself, so I started reading aloud to my cat. That's great. Love it. Whatever helps you feel like you're not talking to yourself, if that freaks you out a little. So whatever is going to make it work for you. You can read novels. Participants have read, the book they're reading for book club. They say they remember it better. They can discuss it better. If you read the newspaper every morning, go ahead and just pick one article in the newspaper to read aloud. A few participants said they have magazines, that have been stacking up, and they just feel like they never make the time to read them. So now they read them as their stronger memory, and they're getting, killing two birds with one stone. They're knocking out their magazines that are piling up, and they're doing that reading aloud. These are some examples of what participants have said about stronger memory. Really positive feedback, especially when done regularly. My favorite quote here is the third one on this page, and I just loved this participant. She came on to a Zoom meeting we had with a big smile on her face, and she had really stopped going out for walks in her neighborhood because she couldn't remember her neighbors' names, and she felt embarrassed. She felt like it wasn't very polite to say hello and not call them by name. She also didn't want to just ignore them. So she'd have become a little bit more isolated. And this was during COVID, when really the only thing she could do was go for walks in her neighborhood. And so after doing Stronger Memory for a few months, she came on the call with a big grin and said, now I remember not only my neighbor's name, but I remembered his dog's name too. And I got to say hello to both of them. And that gave her the confidence to go out and spend more time in her community. So that was really exciting. We did a survey with the senior centers in Maryland, and that was really wonderful to see. It was a great range of participants, and you can see a bunch of them pictured here. They had a really fun time doing these exercises together and talking about brain health. So we had a little over 400 participants in Maryland over the few months that we collected this data, and we had 104 responses to the survey that we sent out. Really exciting. 89% said they were satisfied with the program. 64%, so over half, acknowledged that there was a benefit in brain health, and 86% felt an increase in social connection. So, I don't know if it's the writing prompts or just that discussion over something that we all want to have some hope about in terms of our brain health, but really a great increase in social connection, which with coming out of COVID and a pandemic, we're all feeling that tough situation of being a little bit more isolated, getting ourselves out there. And we know that social connection has a great impact on mental health and brain health. So that's really exciting to see that overall increase. And then more quotes from our participants, but also from our facilitators. So Carol Zimmerman from Maryland County, from MAC in, I think that's not Baltimore County. She said that it seems to be a wonderful intervention as people are experiencing some of the normal aging symptoms. Another director said it's rewarding to call their participants and caregivers and hear their stories. Everyone's enjoying reading out loud. And then in Baltimore County, their caregiver program manager said, it's great to know we can be a positive resource for people concerned about memory loss and dementia by offering a free virtual program to caregivers who said they needed and wanted something they could do together. Now it's an engaging part of their day where they're spending time together. So that feedback is from a few different facilitators of Stronger Memory groups, some who were having individuals and their spouse or their caregiver do these activities together, and others who are doing it as part of a group. But in both cases, it really created connection and community in addition to those brain health benefits. We're continuing to do research with George Mason University. We have found, they did share that we have seen a statistically significant improvement in the mini MOCA cognitive screening from before someone starts the program to 12 weeks later. So that's really exciting. We are gearing up for a presentation in January, which I will be sure to send out to Eden and Clemmy and make sure that if any of you want to attend, you can attend that webinar. And then they also started a blind trial to focus really on that social component. So if individuals are doing this with a partner or a group, or if they're doing this just on their own, are they getting the same benefit, or is the key really that social piece? So we're really excited to be working with them at George Mason. So that's it. That's the overall summary. I like to leave a lot of time for discussion and questions. We have a lot of ways to get involved. You can download the workbook for free. You can start your own group. We have all of the materials. We have a great facilitators toolkit that has everything you need to know, worksheets for you to start discussions on, to start discussions each week if you meet via Zoom or if you meet in person with people. I know at the PMD Alliance conference, a few people said they had the idea to maybe just add it as, 10 or 15 minutes to their existing support group. So you can do it that way as well. It's really simple, really risk-free, and we're just excited to be here to answer any questions and share this great brain health tool with you. I'm gonna stop sharing my screen so I can see everybody.
We do have some questions. So it does seem like these all go together, hand in hand.
Mm-hmm.
And so like you have to do all three, because for example, like someone asked, well, what if I'm math phobic? Or, for example, if you just you're like, I'm happy to do math, I'm happy to write, I like to read to myself, I don't read out loud. How does that work?
That's a great question. We definitely recommend that people do all three. With that being said, I know several participants who have done just one or two. And what I've seen is that if you're doing 2 out of the 3 activities, you're still getting that benefit. If you do them, maybe you do each one for closer to 15 minutes a day. But that's, that happens. Sometimes people struggle with reading due to eyesight, or like you said, they're math phobic. They just really don't want to do the math. Or it's the opposite and they feel like the math is too easy. So even if you just do 2 of them, that's great. Honestly, to get started, even if you just start with 1, that's a good start. Nothing can really hurt.
And someone did ask, is this 7 days a week for all 3?
Yeah, we recommend 5 to 7 days a week. So a lot of people do 5 days a week and see a benefit. So that's kind of what our research says. If you do it 3 days a week, you might see a little bit of a benefit, but it's really that 5 days a week and that consistency that makes the biggest impact.
Okay. You talked about the research with George Mason. Has any of the research been done specifically with Parkinson's patients?
It has not yet. I am, really hoping that we can get there, that we can do some research with Parkinson's specific patients. We have had a few Parkinson's patients be part of our other groups, kind of more on an, anecdotal basis, but we have not done a study just with Parkinson's. But I think that would be really interesting. I can see some of the comments coming in, and I see reading aloud is also a great speech therapy technique. That's definitely true. And so I think there's a lot of avenues we can go with StrongerMemory to make it even more useful for the Parkinson's audience,
Mhm. And someone asked if singing is kind of comparable, the same as reading aloud. Like if somebody was more comfortable just singing, would that count? Or is it like, no, you need to be reading aloud? That's really what it's supposed to be.
That's a good question. I think it's hard because this is a newer intervention. We don't have research to say that yes, singing does the same thing. What my instinct says, usually I'll tell people, if you're singing something and you're reading the words or you're reading the music, that is great. You're working a lot of your brain. If you're singing something that's memorized, that's maybe working different parts of your brain. But overall, doing any kind of music activity is great for your brain, especially if you're learning music, learning a new instrument, learning how to sing a new song. That is great for your brain, not just your memory, but also for that ability to continue to learn new things, be flexible as you need to change ways that you're doing something. So music is a great way to do that. I see Teresa in the chat. She is our outreach coordinator. She's answering some questions. So thank you, Teresa.
Actually, and I will say, I will remind everybody to save your chat because there has been some very good information. If you go next to the chat box, you'll see the 3 little dots. If you click on those at the top, it says save chat. So this way you can keep all this good information because it really was, some very good stuff. Now, somebody had asked about, back to the writing, when you're doing the writing, is it okay to just write with your dominant hand, or should you also be trying to mix it up a little bit and try with the other less dominant hand? Does that help, or it's enough the act itself of just the writing?
Yeah, the act of in and of itself of just the writing is enough. If it makes it more interesting for you and more likely that you're going to do it every day, if you switch it up or if you try mirror writing, then you certainly can do that. I have someone who does that because she finds just the regular writing kind of boring. But just writing with your dominant hand is definitely enough.
And then let's see. Somebody did ask about, what about, has there been research on learning a new language? Does that help at all?
Yeah, learning a new language is a great way to work and improve our neuroplasticity, which is a big word that kind of means what it sounds like. It's our ability to create new pathways in our brain and new brain cells. That might get harder with age or with certain illness, but it doesn't fully diminish. And so, if we think of needing to learn how to do something new, or maybe our body changes and we can't do something the way that we're used to, that neuroplasticity, that ability to create new brain cells, new neural pathways really helps us with that process. And learning a new language is a great way to exercise that.
Someone asked if this matters at all that he had DBS? Does that change any of this, or nope, you would still get the same benefits? Like I would not think the deep brain stimulation would matter, but I saw the
Yeah.
question and I thought Jessica probably knows this a little bit better than I do. So
Yeah, I don't know. I don't think it would make an impact, but I'm not sure. I don't think we've definitely I don't know that we've had any had a lot of participants who've disclosed that. So that's interesting. Yeah.
now, just for my own clarification, it does sound like this is meant more for kind of the lapses in memory, if you will, like when you're like, oh, what's that word? What's that word? Or like, what's that person's name? Like that one example with, I can't remember my neighbor's name or her dog. And
Yeah.
it's for those kind of little glitches we almost get as we get older.
That's a good way to put it. Yeah, it definitely is meant for that. We do have some residents and participants who have more significant memory challenges that benefit as well. But it really seems like the most kind of involved and passionate participants are those who notice some of those little lapses, and they're able to do these exercises daily and not you know not forget about doing them and make it part of their daily habit.
Mhm. Perfect. Does anybody have other questions? I'm very impressed with Dave, who can now do pi out to 150 digits. I'm like, I can't even imagine, but
That's amazing. Yeah.
I'm kind of thinking though also, what about those like games that you play? Like I'm going on a picnic and I'm bringing apples, or I'm going on a picnic and I'm bringing apples and bananas, and then until you go through the whole alphabet. I
Yeah,
mean, is
yeah.
that like,
Those are good. I mean, yeah, anything that's stimulating your brain, especially if there's that social component,
mhm,
is great. There's a few great resources out there on brain health, and I can share some of those. AARP and healthybrains.org, they both talk a lot about the 6 pillars of brain health. And so that is to engage your brain, stay socially engaged. There's some nutrition, eating brain healthy foods, managing your stress, getting exercise, and getting restorative sleep. Those are, unless I said one twice, those are the 6 pillars of brain health. So all of those do a great job to um, you know, connect the brain and exercise the different parts of the brain. Thanks, Kelly. I saw Kelly just put it in the chat.
and then somebody asked, does it help for the situation when you're talking away fine, but then you forget where you're going? So it's almost like you're doing two things at once. So you would,
Yeah, yeah. I think it definitely can help with focus. So we've had a few people say that it really helps with focus, and it helps with that awareness. Sometimes, we multitask and we're not even aware that we're multitasking like that. And when we're multitasking, our brain is not, as much as it feels like I have 2 tracks going in my brain all the time. But as much as we think that we're doing 2 things at once, our brain is actually switching really quickly between tasks. And so it's switching so fast, we don't always notice that switch, but doing something like StrongerMemory can help that focus, can help our brain, recall that information. Wait, what was I just doing? And can definitely help with that.
yeah, I read that and I was thinking, I remember the nurse practitioner I used to work with would say, it's not a problem if you walk into a room and forget why you walked into a room. It's a problem if you walk into the room and you don't know what the room is for, like you're trying to cook in the bathroom. Or
Yeah.
she said, like, it's not a problem if you don't remember where you put your keys. It's a problem if you forget how to drive the car. And
Yes,
so,
I think that's a
um,
really good way to put it. And we are, as a society, growing older living longer, which is fantastic. And I think there's definitely more worries out there about our brain health. And so definitely, Eden, what you said is absolutely correct. There's a lot of things that sound like a big concern, but part of why people really stay connected through Stronger Memory is because I think they realize that a lot of this is, normal. It's fixable, and it's normal. So it's not a cause for major alarm bells.
Someone asked, is there a better time of day to do these activities to help with the brain health?
I would say it depends on, everybody kind of has different cycles to their day and when they learn best or when they function best. So if you're a morning person, then maybe do these exercises in the morning. I know some people who are night owls and they'll stay up and they'll do it in the evening, they'll do it after dinner. You can do the exercises all together at once, or some people will split them up. Wendy, the kind of pioneer of Stronger Memory, is still doing these exercises. And she gets up and does her math in the morning because she doesn't like it. And so she gets it out of the way. And then after breakfast, she calls a friend and they take turns reading aloud together. And then she does her writing in the evening before she goes to bed. She writes in her journal. So you can kind of spread it out throughout your day or do it all in one chunk. The main key is just creating that consistent pattern, a consistent time of day, because that's going to help you fit it in that 5 days a week to really notice if it's making a difference.
I don't know if you or Teresa want to put this in the chat, but someone asked if you're looking for participants in the study.
That's great. Right now, we don't have an ongoing study, but if we have participants, people who are willing to partner in a study, we could definitely look at doing something. We do have a few tools for kind of less official than our studies run through universities, but we do have some tools for evaluation, like what we did in Maryland, where we can provide you that and assist with that and that analysis.
Somebody did say that they participated in drumming circles and was told the drum was the only instrument that uses the entire brain. Jessica put the information about Stronger Memory in the chat. There's also, we had put the website and everything. So again, we encourage you to save your chats.
I believe that about the drumming circles. That's fascinating. I hadn't heard that before, but that makes a lot of sense. I love drum circles. They're a lot of fun and definitely get your brain buzzing in a good way.
Now, obviously you've done some of this, but we do have some young onset patients. And I feel like sometimes, especially for like moms, it's like we just so much going on in the brain that it's like, I joke when everybody makes fun of the fact that I can't remember a word. I'm like, if you knew what was going on in this brain, you would understand why I didn't remember the word probability or something.
Yeah.
Do you think this helps in that situation as well? Because I know some of our young onset patients are really just multitasking away right now with.
Yeah, absolutely. I think, yeah, I know we have some individuals who've done Stronger Memory due to a traumatic brain injury, or other brain challenges. So they're not necessarily older, but still having those challenges. And I think part of what Stronger Memory does is it really, especially the math, it really helps our brains remember how to focus. And so it's interesting. I've heard several of my groups talk about multitasking, after they've been doing the program for a while and realizing like, oh, it's actually not as productive if I multitask, but that ability to just focus on getting the one thing done and then the next gets a little easier.
Somebody asked how we can get the workbook.
Yeah, that's a great question. I think Teresa's put that in the chat and she's probably putting it in there again. We have the full workbook available online on our website that you can download as the PDF. It is, I think, about 170 pages. We do sell the workbook at cost. We're not making any money off of it, but we want it available for people who might want a printed copy, and you can do that at StrongerMemory.com or StrongerMemory.org.
Someone asked, is there any research that shows that doing a physical task at the same time helps, like bouncing a ball while doing the math, or riding an exercise bike while reading out loud? I can't imagine doing the math and bouncing a ball, but I'm thinking maybe at least chewing gum or something.
Yeah. That's interesting in terms of like, because I think about it like that multitasking that could get kind of tricky. But I will say the best thing you can do for your brain is physical exercise, even just walking 15 minutes a day, or walking's not your thing, doing some light arm exercises or weights, something like that, that can really, anything that gets your heart rate up a little bit for 15 minutes or so a day is a really great thing to do with your brain. I work in healthcare, and so my immediate thought is, oh no, if you're reading aloud and riding an exercise bike, like, I don't want you to fall, but I'm going to leave that one up to your individual judgments.
That would be multitasking at its finest, because you don't need to be multitasking. You're doing it deliberately. You're making a concerted effort to do it.
Yes, absolutely.
Versus I have no choice but to, cook dinner and help with math homework at the same time, for example.
Right. Yeah, absolutely.
Does anybody have any questions? Oh, Teresa's put a bunch of stuff in the chat about near the top of the page. You'll see headers like get the free workbook and more research. Thank you, Teresa.
And I think Teresa answered it, but I'll answer it verbally too. I think there was a question about the facilitators training. We have all of the printed resources online. We're working, and we have some videos online too. We're working on a more formal online training for that, facilitators, if you want to lead your own group. But in the meantime, you get to talk directly to Teresa or myself. We're always happy to hop on the phone, hop on Zoom, and kind of go through what each of those resources on the website are and talk with you about how you can roll this out with your group. And we love to hear feedback, good and bad. We like to know what's working and what's not, so we can keep making this a better and more useful program. And we love to be able to share stories and highlight if there's something great that you're doing. We'd love to hear about it, so we can just share and amplify the great work that you're doing.
So I do really like this one. Someone asked what about watching a movie and reading the subtitles out loud? And that to me just seemed a lot more fun than just reading a book out loud. Like, I'm thinking like, you and your partner could act out a scene. Like, okay,
that is really interesting. That's fun.
I'll take that character. And then you can both practice.
Yeah, I'm gonna have to study that one. I don't know. I'm gonna have to try it out.
I'm like, I thought that would be really kind of cool.
Absolutely. I see too. Thanks. I see Orlando Jack said the NIH recommends water aerobics as one of the best exercises for anyone, especially those with movement disorders. That's really helpful. Thank you for sharing that. That's a great low impact exercise.
Somebody did also ask, and I'm not technologically savvy, does recording the chat have to be done at the end of the session, or will it pick up info after requesting to record earlier in the program? I believe it will, but I like to ask my tech guru, my awesome coworker, Kelly, who I failed to introduce, and she'll know.
Hi, everybody. Yeah, so whenever you save the chat, it'll save the chat as it is in that moment. So if things are added to the chat later on, you're going to miss them, which is why we usually say at the very end of the live stream, we give you that reminder to save the chat, because then you'll get the entirety of the chat. So. Oh, and then, yeah, where you save the chat, if you've got the chat box open, depending on your device, that may be on the side, it may be at the bottom of your screen, but you scroll to the bottom of the chat, and in the bottom right-hand corner, there's 3 dots. So you click on those 3 dots, and then there's an option to save the chat.
And then somebody also said he had a great experience doing improv, which kind of goes back to what you were saying about keeping things enjoyable, stress-free. It might not necessarily help with the memory, but.
Right, absolutely. And I think improv is really fascinating. I work with someone who does she does improv training with individuals who have dementia. She calls it creating the dementia ensemble. It just teaches everyone to be really flexible with each other, to have humor if we're not, communicating on the same exact, path. I've got one goal, you've got the other. If we just look at ourselves like an ensemble, an improv ensemble, then we just kind of roll with it and figure it out. So it's really that's a really great tool for brain health and just for life in general.
Isn't that the truth? The yes and that is improv.
Exactly. Yes.
Embracing life. And so we have a tradition here at PMD Alliance, our wave of gratitude. We're so grateful that you took the time to come and speak with us today and give us something that we could do, like that's genuinely going to help. That's, 10 minutes and just really hopefully get something out of it. So thank you so much, Jessica. We appreciate your time today. And thanks everybody for spending your Monday with us.
Yeah, thank you so much. This has been lovely. So glad to be on here with all of you.
Thank you. And thank Teresa as well. Yeah. Thank you, Teresa. Jessica, it's been wonderful. Thank you.
Thanks so much.